Hi, thanks for tuning in today. I've been thinking about doing this little video for quite a while. I've mentioned alternatives to some of the treatments that are out there for a variety of things in some of my other YouTubes, and certainly dealt with some of that in my book. But given that I was diagnosed with MS in 2004, MS is clearly one of the things that I stay very current on. And if you're watching this and stay current on MS, you know that CCSVI, or the liberation treatment, has been in the news now for some time. It's a theory that was put forth by a Dr. Zamboni. He tried the therapy on his wife and a number of other patients and felt that MS may or may not be an autoimmune disease, which I put forward in the suggestion of that in my book, but that it might have something to do with blood flow and the speed at which blood flows through the brain, giving the opportunity for things that shouldn't cross the blood-brain barrier to cross the blood-brain barrier, whether that's iron or any of the other things that have come up in studies related to CCSVI, or let's just call it the liberation treatment. Lately, there's been more and more in the news about it. In Canada, there are several provinces that are looking to put money behind testing or making available the liberation treatment. There was also just recently a television show on network television about MS and Dr. Zamboni's treatment and its availability. And often in these cases, there's a fight between what's considered to be clinical evidence that's generated based on a well-designed study, and anecdotal evidence, which are basically people who actually have the disease commenting on what works and what doesn't work. And CCSVI liberation treatment has had excellent anecdotal feedback by many of the people, not all the people, but many of the people who have gone and had the treatment done. And the treatment, very simply put, in non-medical terms, is like an angioplasty done on the heart, balloon-type devices inserted into the veins in the neck and blown up, and the goal is to increase the blood flow in the brain. And some of the effects of increasing blood flow for those who have enjoyed benefits from it have been almost instantaneous. Others have had no effect, and some have had improving effect over time, and some have actually had some of the benefits decrease over time, which might indicate that the blood flow is slowing down again, or the arteries and veins are getting clogged again. The point of this little video is to talk about what I think may be and should be looked into as an alternative to the liberation treatment, and that's intravenous chelation therapy. When I was diagnosed with MS in 2004 and looked up what the other things MS could possibly be, what other things could possibly cause the symptoms that I was experiencing, mercury toxicity came up regularly. When I went back to my neurologist at the time and suggested that that was a potential, he basically dismissed it. I didn't take that no for an answer, went to a toxicologist, got tested, and he came back to me and said I was the highest, I had the highest level of mercury contamination of anybody he had seen in 35 years that didn't work with it on a daily basis. Now, part of that was I ate a tremendous amount of seafood. Part of that was that my age, I had a lot of old decaying mercury fillings in my mouth. And part of it was that early on I'm an engineer and worked at coal-fired power plants, and the burning of coal is definitely a source of airborne mercury. So I basically had the perfect storm there, and no doubt genetically, I guess my body doesn't eliminate it as efficiently as perhaps other people's bodies may. So to get to the point, a chelation therapy was the way to fix the problem of mercury toxicity. It's basically standard of care for lead poisoning and mercury poisoning. And the way it works is you get hooked up to an intravenous bag. There's a drip. There's a bunch of chemicals in the saline either DNPS or EDTA, or there's a couple of others, that sort of draw the mercury out of your body and leave it in a form where you can readily eliminate it, basically pee it out. We could see, based on testing, that I had gone, at the time the scale was different than it is now, but I had gone from 122 or 121 on this scale to less than 1 in the course of several years. Probably saw most of the decrease in the first 12 to 18 months of having these regular intravenous chelations. But a side effect of intravenous chelation, which you can look up on the internet, and there's all kinds of reading about it, and there's all kinds of studies on it, is that it tends to remove some of the blockages and plaque in your veins and arteries. Now, that may sound very familiar to the liberation treatment, and certainly is one of the reasons why it's so helpful to some people as an alternative to treating circulation and heart-related issues. Now, the American Medical Association and the people that believe in intravenous chelation for the off-label use of heart and circulation-related issues have been banging heads for years about whether chelation is snake oil or whether it really works. Again, there are tens of thousands, hundreds of thousands of people that have had intravenous chelation, often after having bypass surgery and or stents put in and or angioplasts, who had reached the point where they were no longer candidates for some of the conventional treatments and ended up going for intravenous chelation for the purpose of increasing their circulation and dealing with angina and some other heart-related issues. So the question I have, and the question I want to pose in this little video today, is shouldn't somebody be looking into intravenous chelation as a potential non-invasive, non-surgical alternative to the liberation treatment? Perhaps the right combination of chemicals, minerals, and vitamins in that saline drip may provide not only a significant reduction in the blockages, which is what it does in theory for heart and circulation, allowing better blood flow through the brain so that there's not as much time for bad things to cross the blood-brain barrier, and also hopefully that some of the bad, quote, bad, unquote, things are chelated out of the body. And I felt like it was very important to say that I have had over 50 intravenous chelations, had no additional symptoms. As a matter of fact, if anything, a reduction of many of my symptoms from my serious MS attack in 2004. And I can't attribute all of that to chelation therapy. As a matter of fact, I'm a proponent of LDN, low-dose naltrexone. If you don't know what that is, I've done some YouTubes on that. Please have a look at those. And I might add that low-dose naltrexone has been effective on a whole bunch of things because it works on sort of moderating or modulating your immune system, as opposed to some of the way other drug-type treatments work. Naltrexone is an FDA-approved drug, and you do need a prescription for it. And for the illnesses, autoimmune, specifically some cancers that I'm talking about, it's taken in very low doses, hence LDN. But that chelation therapy should be looked at as a, if not a replacement or an alternative to the liberation treatment, but perhaps a supplement or augmentation of it, so that once the treatment is done, you could be put it on chelation therapy on a prophylactic basis to help keep the blood flow flowing the way it needs to be flowing in order for you to feel good and be healthy. That is my video today. I appreciate all the emails and comments and kind words I've had, both on my books and my book. There's another one on the way, and my YouTubes. And here's wishing you your best possible health. Bye-bye.